Winter Park OB-GYN, a division of Women's Care Florida. This presentation was created to give you information on your new pregnancy. Please view and listen to this presentation prior to your next visit. Consider getting a pen and paper to write down questions you have regarding the content. You'll be given an opportunity to ask them at your next appointment. There are multiple links throughout this presentation, and you do not have to view all of these. They're just there for further reading if you'd like to view them. These are the faces of the people that will be caring for you during your pregnancy. Doctors Bruce Bright, Stephen Duke, Esther Lincourt, Anne-Marie Jones, Wendy Whitcomb, Yelena Adlanova, and Kate Hughes, nurse practitioner, will be caring for you during the pregnancy. We try to get you to cycle through and meet all the doctors in the practice because the one that is on call when you deliver is who will be delivering your little one. We have 3 locations to serve you. Winter Park is our main location, and all ultrasounds are completed here. Waterford Lakes and Oviedo are both also available to better serve you. We get lots of questions about the schedule of visits during a routine pregnancy. In general, from weeks 8 to 28, you'll have 1 visit per month. Starting at week 28, you'll be getting 2 visits per month. And at 36 weeks, you can expect a visit every week. This is what you can expect on your first visit. We'll be going over your health history, medical problems, discuss your medication, complete a physical exam. You'll have lab tests, weight and blood pressure readings. You'll get your due date if you haven't already, and we'll discuss genetic screenings as appropriate. And as always, we'll address any questions or concerns you have related to your pregnancy. In later visits, you can always expect that your weight and blood pressure will be checked. In middle to late pregnancy, we'll also start to measure your abdomen to check your baby's growth. We'll be listening to your baby's heartbeat. We'll discuss your test results and answer any questions or concerns about your pregnancy. This is a timeline of some milestones in your pregnancy visit. We're often asked when we get that ultrasound to look at the gender of the baby. That's done at 20 weeks of pregnancy. At 28 weeks, we do a blood glucose test to make sure gestational diabetes hasn't developed during the pregnancy. This is your cue for more frequent visits. It's when we start to see you twice per month. At 35 weeks, you can expect a Group B strep swab. This is a common bacteria that can be found in pregnant women. If found, you may need to receive antibiotics prior to delivery. At 36 weeks, we'll begin your pelvic check to look at your cervix and the position of the baby. These will continue weekly until you deliver. Winter Park Memorial Hospital's boutique baby place has many amenities and services available to suit your family. Their website has extensive information on all the wonderful things My favorite was the smoothies every day and the masseuse that came in to give you a foot massage and back massage after you have the baby. Please pre-register at the hospital online or drop off the form that will be provided to you at your visit. At this website, you can also look up information on childbirth classes. They're all available at the hospital. First-time parents, we recommend the Gift of Motherhood series. This is a series of classes that will prepare you for bringing home your new little one. For our mothers who have already had little ones, there are also classes available for siblings and infant first aid. Grandparents may also want to take a class. Make sure you check out their website. We get many questions about genetic screening tests. We do offer screening for chromosomal abnormalities in the practice. You have the option to decline or complete the genetic screening. You should ask yourself these questions listed on the slide to figure out if genetic screening is right for you. It's important to know that most but not all fetuses will be detected with our screening. The screening we offer incorporates both first and second trimester screening. First trimester screening involves fetal nuchal translucency. This is an ultrasound done between 11 and 13 weeks that looks at the thickness of your baby's neck and the markers in your blood. This test is non-invasive and carries little to no risk. The blood test and ultrasound are combined, and they generate a risk for abnormality. If the screening is positive, then we immediately inform you and you're offered further testing. If the initial test is negative, then the patient goes on to the second trimester screening. The second trimester screening involves a blood test called the MSASP. This is a fancy way of saying it measures markers in your blood for spinal tube defects or other placental abnormalities. Our practice recommends that all patients have this screening because it affects the management of your pregnancy, even if you decline screening for chromosomal abnormalities as discussed on the previous slide. When you're filling out your paperwork, you are going to see two forms. One of them will discuss ultrasound screening for the neural tube defect. The other one is the genetic screening abnormality that involves this MSASP test. You also have the option to choose diagnostic tests only, or you can use these diagnostic tests as follow-up if the screening is abnormal. If you would like screening early in the first trimester, CVS, chronic villus sampling, is available, and in the second trimester, amniocentesis is available. These tests do carry some risk of infection and miscarriage, and you're sent to a specialist outside our practice to have them performed. Here's some information on nutrition during pregnancy. As a rule, we encourage you to eat a healthy diet full of fresh fruits, vegetables, and meat and whole grains. My rule of thumb is It's best to eat things with no nutrition label at all. Here's a link for further reading on nutrition and pregnancy. There's a common misconception. People say, you're eating for two, so make sure you eat plenty. Not really an accurate statement, and it should be avoided to prevent excessive weight gain. During pregnancy, an extra 300 calories per day is all that is needed. That's the equivalent of about a peanut butter and jelly sandwich. Many people talk about which foods we need to avoid during pregnancy. Raw, uncooked food, soft, unpasteurized cheeses, excessive caffeine, unwashed vegetables, alcohol, and high mercury fish are a few that we definitely recommend you avoid. Provided are links to comprehensive lists of safe versus unsafe fish to eat during pregnancy and a more detailed explanation of foods to avoid. Please take a look at these and even print them out if you need more information. We do not recommend that you smoke cigarettes, drink alcohol, or use any illicit or recreational drugs. If you need some information on smoking cessation during pregnancy, here's some helpful resources, and make sure you discuss this with us during your visit. Over-the-counter medications, vitamins, and herbal supplements are addressed in the handout given to you at your last visit. This handout is also available on our website. As a rule, if you have any questions, please call our office and speak to us before taking medications, over-the-counter supplements, or any herbal preparation. We recommend that you use a prenatal vitamin with DHA in it during your pregnancy. These can be purchased at your local drugstore and used during your pregnancy. The ones available at the drugstore are perfectly safe and very cost-effective. If you'd prefer a prescription for some reason, please discuss this during your visit. This is information on weight gain during pregnancy. If you are normal weight, 25 to 35 pounds is the recommended weight gain during pregnancy. If you are underweight, overweight, or obese, these recommendations change. A BMI calculator is located at the bottom of this slide. One of my tips for helping with recommended weight gain during pregnancy is to avoid those liquid calories. Liquid calories get us into trouble. Try to drink as much water as possible. You'll be provided a water bottle at your next visit. We recommend that you drink at least 4 to 5 of those a day while you are pregnant. This helps provide you with the water that you and the baby need and avoids excess calories. Some of our big culprits with calories are smoothies and chocolate milk. Exercise during pregnancy is encouraged. Research shows that regular exercise increases your energy, prevents high blood pressure, prevents gestational diabetes, decreases postpartum depression, the aches and pains of pregnancy, and helps you to prepare the body for labor. We recommend 30 minutes or more of moderate exercise a day on most, if not all, days a week. unless for some reason you are otherwise advised. As a rule, if you can carry on a conversation while you're exercising, you're going at the right level. If you can't speak normally, you're pushing yourself too hard. And a quick tip, don't lay flat on your back for exercise after 4 months gestation. If you are not working out prior to pregnancy, it is okay to start walking daily. The Mayo Clinic has some more information on this topic and starting to exercise for the first time during your pregnancy. If you are working out prior to pregnancy, in general, you can continue your workout routine. However, you should avoid contact sports, sports that place you in a high risk of falling, and heavy weightlifting during pregnancy. Examples of safe activities are outlined on the slide. There are many resources available to you to track the development of your baby during the pregnancy. We do caution you, however. We've provided you with many resources in this presentation. Please avoid blogs and other information contained within them for making healthcare decisions. There are many common pregnancy concerns that we're asked about all the time. One of them is round ligament stretching pain. This pain occurs as the uterus starts to expand and can feel like a pulling or a cramping on either side of the uterus. Typically, this pain subsides when you sit down and rest. Heartburn and acid reflux, low back pain, leg cramps while you're sleeping or in the evening, constipation, and how to sleep properly are also things we're asked about frequently. These are addressed in detail at the link provided to you. There are many vaccines that are safe during pregnancy and promote the health of mother and baby. In our office, we encourage that you receive the Tdap after 20 weeks gestation. This provides protection against whooping cough for your infant. Family members that have close contact with the child can also receive this vaccine in our office. We also recommend the influenza vaccine during flu season. During your pregnancy, you'll be screened for rubella and chickenpox immunity. If you are not immune to these viruses, you will be offered the vaccine after you have the baby. Toxoplasmosis is a small parasite that should be avoided during pregnancy. Please don't change cat litter boxes or clean bird cages if you can avoid it while you're pregnant. And if you have to clean them, please wear gloves and a mask. Other ways to avoid toxoplasmosis is to wash all your fruits and vegetables well before eating. Avoid digging in any outdoor gardens without gloves. And cook all your meats thoroughly. And wash your hands well after handling any raw meat. Sexual activity is considered safe during routine pregnancy. Sex cannot harm your baby, and it cannot cause a miscarriage. If you're having any bleeding, pain, or discomfort during intercourse, please do not resume intercourse until it's discussed in our office. Travel during pregnancy. Air travel and car travel is safe during pregnancy until 34 weeks gestation. After that time, air travel should be avoided, and car travel should be limited to trips an hour from home. For longer trips, or trips later in your pregnancy, please discuss these with your physician prior to traveling. When you're traveling, make sure to fasten the lap belt underneath your growing belly and across the top of your thighs to avoid pressure on the baby. And when you're taking trips, make sure you get up and walk around every 2 hours for at least 5 minutes to help promote circulation. And as a note, if you guys are planning a cruise, just know that they have to be completed before 24 weeks gestation per cruise guidelines. "3D and 4D ultrasounds are optional in our facility for your enjoyment. They're not part of your routine prenatal care, but they can be a nice way to meet your baby prior to delivery. The optimal time to receive these are between 28 and 32 weeks. Speak with the front desk for more information about this. Domestic violence is common during pregnancy, and if you're in any unsafe living situation, please discuss this with us. There are many other decisions that you'll consider during your pregnancy. There's pain management options while you're in labor. You'll have to choose a pediatrician prior to delivering at the hospital. If you're having a little boy, you'll have to think about circumcision or no circumcision. You can think about choosing a feeding method, such as breastfeeding or bottle feeding. Cord blood storage is also becoming popular. You'll be given information on this in your new OB bag. Please review it. Another thing to consider is what method of contraception you'll like to use after delivery. If you choose breastfeeding, traditional birth control pills may not be used, as they can cause problems with milk supply. So we may need to discuss other forms of contraception. Please remember that most babies are born healthy, and congratulations on your pregnancy. Take as much time as you can to enjoy it. Relax, breathe, and smile, because you have a great team here to work for you.